Chapter 5, Special Phlebotomy Procedures. Contents in this chapter are: bleeding time, platelet function, blood alcohol testing, blood donation testing, forensic testing, glucose testing, therapeutic phlebotomy, timed specimen, toxicology, bleeding time or platelet function. The bleeding time refers to a test that identifies function disorders of platelets, also known as thrombocytes. Thrombocytes prevent blood loss due to injuries or wounds by releasing factors that promote the clotting of blood, coagulation. By doing so, platelets help maintain homeostasis, steady state condition. Lasting or prolonged bleeding may take place because of abnormal platelet function or due to an insufficient amount of platelets. If a person has an abnormally high amount of platelets, it can cause blood clots and lead to obstruction of blood vessels. A normal bleeding time is between 2.5 minutes and 9.5 minutes. Causes for lasting or prolonged bleeding time may include platelet disorder, fibrinogen disorders, medications like aspirin, and scurvy, bleeding time or platelet function equipments, alcohol to clean, sphygmomanometer, bleeding time device, stopwatch, bleeding time or platelet function. The test measures platelets' ability to stop bleeding after wound/injury. Bleeding time device, placed firmly on patient's forearm, makes incision. The incision is 1 mm deep and 5 mm long. Platelet function assay may be used with patients using aspirin or NSAID drugs. Bleeding time or platelet function, the procedure. Place patient's arm on a stable support, palm facing up. The selected site should be on the dorsal side of the mid-forearm. Place sphygmomanometer on the upper arm. Check that the selected site is without scars, exposed veins, and remove excess hair. Clean selected site with alcohol. Alcohol should be allowed to dry 30 to 60 seconds. Inflate sphygmomanometer to 40 mm of mercury. Check that it stays at 40 mm of mercury. Place device on site parallel to antecubital crease and apply light pressure. Push the device trigger at the same time as the watch. Dispose of device in a sharps container. Begin timing at the time of puncture. Blot the blood flow by using filters/paper after 30 seconds. Blot the blood flow repeatedly every 30 seconds until blood flow stops. If bleeding continues for more than 15 minutes, stop timing and apply pressure. Make note/record that bleeding time exceeds 15 minutes. Blood alcohol testing. Blood alcohol testing measures the amount of alcohol within the body. Because alcohol absorbs quickly into the blood, it can be measured within minutes after having an alcoholic beverage. The highest level of alcohol in the blood is present about 1 hour after having the alcoholic beverage. The majority of the alcohol will be broken down within the liver. The remaining alcohol is passed out by exhaling and urination. Increased amounts of alcohol have a sedative effect, depressing the central nervous system. A blood alcohol test is commonly used to determine if a person is intoxicated. The most common request for blood alcohol testing is by police officers, in order to determine whether a person is driving under the influence of alcohol above the legal limit. The procedure: wrap a tourniquet, elastic band, around the upper arm to stop blood flow. Clean site with non-alcohol solution, alcohol content. Insert the needle at a 15 to 30 degree angle with the bevel side up. Fill collection tube. Remove tourniquet after bleeding starts. Apply gauze as the needle is removed. Put pressure on the puncture site and check that bleeding has stopped. Blood alcohol test may be done too. Check blood alcohol if a person is suspected of driving intoxicated, under the influence of alcohol, above the legal limit. Check blood alcohol in underaged people. Check blood alcohol in people in alcohol treatment programs. Find the cause of confusion, altered mental status, or even coma in people. Blood donation testing. A phlebotomist may also perform specimen collection in blood donation facilities. Blood is collected from donors in order to be used for patients in need of blood products. Donor units are separated into components and require precise labeling, in order to trace each unit back to the donor. Blood donation testing. Each donor unit provides red blood cells, erythrocytes, plasma, platelets, thrombocytes, blood typing reagents, blood clotting factors, proteins and immunoglobulin. Donor candidates must be between 17 years and 66 years of age. Give permission or have written parental consent. Be in overall good health. Weigh a minimum of 110 pounds. Have a sufficient amount of hemoglobin and/or hematocrit. Autologous donations. A person donates blood for their own future use. If blood is donated before surgical procedure, the following criteria must be met. The written order of a physician. Capable of regenerating red blood cells. The level of hemoglobin must be at least 11 grams. The surgical procedure cannot be within 72 hours after donation. Blood donation testing. The procedure. Two-step cleansing process, using iodine preparations. Selection of large veins, generally the antecubital area. 16-gauge needle and evacuated tube system are used. The anticoagulant in tubes is citrate phosphate dextrose. If the tube does not fill completely, the sample must be discarded and the procedure repeated. Blood donation aftercare. In any blood donation procedure, the patient must be monitored for any side effects such as dizziness and/or nausea that may occur. If side effects occur, make sure to keep the patient in a supine position, lying face up on back, with the head lower than the heart. Forensic testing. Forensic testing is usually associated with court proceedings/legal cases. All forensic testing must follow a chain of custody procedure which requires any person handling specimens or samples must date and sign a legal document. Further requirements. Specimens must always be stored or kept in a locked container. The legal document must state person's name specimen was received from, person's name collecting the specimen, person's name specimen was given to, length of time each person handled the specimen. Specimen collected for forensic testing may include blood, hair, saliva, sperm, sweat, skin, nails, teeth, bones, vegetation. Guidelines. Gloves must be worn at all times. The specimen must be collected as soon as possible. Accuracy in packing, storing, and transporting the specimen is essential. The specimen must be labeled properly. All handling of specimens must be recorded. Glucose testing. Blood glucose testing measures the amount of sugar, glucose, in blood. Glucose is the primary energy source of the body. During the digestion process, carbohydrates break down into glucose. Blood glucose testing may be ordered by physicians if the patient shows signs of diabetes or if the patient is diabetic to check glucose levels. Glucose level is the most common requested timed specimen. Diabetes. Symptoms of diabetes may include frequent urination, blurred vision, lightheadedness, persistent thirst. Blood glucose tests may either be ordered as fasting blood glucose test, no eating or drinking except water for at least 8 hours prior to test, or random glucose test which can be taken at any time, although foods and fluids the patient might have had may affect the test. The procedure. Clean the area of the lower arm where the needle will be inserted. Instruct the patient to make a fist as a tourniquet is applied. Insert needle and release tourniquet once blood flow starts. Apply pressure to the puncture site and check that bleeding has stopped. Blood glucose testing. A blood glucose tolerance test measures the ability of the patient to metabolize a large dose, oral, of glucose. Patients that receive a glucose tolerance test have been fasting and are therefore susceptible to fainting when given larger amounts of glucose. The phlebotomist should accompany the patient to and from the drawing room or area in order to prevent any injuries. Blood glucose tolerance test. Collect initial fasting blood and urine. No further testing is required if blood glucose level is above 200 mg/dl. They will just consider you diabetic. The patient is given a large dose of glucose solution to drink if blood glucose level is below 200 mg/dl. Make sure all of the solutions is swallowed in 5 minutes without vomiting. 3-hour blood glucose tolerance test procedure. Collect fasting blood and urine at 30 minutes, 1 hour, 2 hours, 3 hours. Label each blood and urine sample with the time collected. Patients are not allowed to eat, drink, except water, chew gum, smoke, consume alcohol, leave the facility. Therapeutic phlebotomy. Therapeutic phlebotomy refers to a prescribed amount of blood withdrawn in order to treat blood disorders, such as hemochromatosis, polycythemia, porphyries. Hemochromatosis, a disorder where the body absorbs too much iron from the foods eaten. Extra iron is stored mainly in the liver, pancreas, and skin. Condition leads to diabetes, cirrhosis of the liver, enlarged heart with congestive heart failure, higher skin pigmentation, or irregular heartbeat. Polycythemia, condition of an increase of circulating red blood cells and blood volume. Porphyries, a metabolic disorder that is associated with enlargement of spleen and liver, pigmentation and red color in urine, and sensitivity to light. Therapeutic phlebotomy may be performed every few days or as needed in order to improve symptoms. The procedure for therapeutic phlebotomy is a regular venipuncture procedure. Roughly 500 milliliters of blood are collected per treatment. To perform therapeutic phlebotomy, the patient must have a written request from a physician which must include the following information: amount of blood to be withdrawn, frequency of donation, desired hemoglobin level. Timed specimen. A timed specimen is a measurement of the concentration of a substance, creatine, glucose, sodium, over a specific period of time, usually between 8 and 24 hours. Common timed specimens: glucose levels, iron levels, cortisol levels, peak and depression of medication levels, cardiac enzyme levels, hormone assays, potassium, sodium. For a timed specimen collection, the patient should be instructed to fast for 8 hours prior to the procedure. Fasting in this situation includes abstaining from all food and consuming only water. The patient should also be instructed to hold back from any exercise in order to be in a basal state. If the patient fails to follow the instructions and does not fast, test results for glucose levels and triglycerides may be affected and therefore inaccurate. Lipemia is a condition in which an increased amount of lipids, fatty acids, are found in the bloodstream. This is a common occurrence after meals, which is why fasting is vital before a test can be performed. Critically, lipemic specimens will show a milky, clouded serum as opposed to the normal, clear, or yellowish serum. Toxicology. Toxicology is a branch of chemistry, biology, and medicine that focuses on the study of the adverse effects of chemicals on living organisms. When performing specimen collection for toxicology, the phlebotomist must follow the laboratory protocol. In order to maintain the integrity of the sample, the specimen must not come in contact with any outside influences such as oil, bacteria, or anything that would invalidate the results. Common toxicology testing includes acetaminophen, caffeine, chloramphenicol, ethanol, methanol, acetone, amphetamines, cannabinoids, ethanol methadone, barbiturates, opiates, cocaine metabolites, propoxyphene, Benzodiazepines. Phencyclidine.